at 5.
Suicide is the second leading cause of death among teenagers, according to a new report out today. Good evening, and thank you for joining us. The report is from the American Academy of Pediatrics, and it urges pediatricians to screen teenagers for suicide risks. Valley News Team's Ashley Bishop dug into the report and talked with teenagers about whether their doctors are doing enough.
It's not a most common subject. I feel like it should be more because with the suicide rates these days.
In 2007, suicide was the third leading cause of death for teens ages 15 to 19 years old. It has now moved towards the second. The first cause is unintentional injuries, such as crashes. The American Academy of Pediatrics is publishing updated guidelines to help doctors on how to identify and help at-risk teens. 19-year-old Danielle Lanou says her doctor has asked her about depression and suicide in the past.
I feel like they should ask you more like how you're feeling, like not, like are you depressed and stuff. Just be like, are you feeling okay? Like, how are you doing? And I feel like they're just very robotic about the questions.
But I think there's always a way of going about asking questions, because you can't come off in the wrong way, and it might actually inflict more pain on somebody.
There is no universal requirement for suicide screenings of youth. Some of the guidelines the report states is that teens should be interviewed away from their parents, and some teens are more likely to disclose information via forms than in person.
Some doctors certainly ask youth about symptoms of depression, and then if they screen in for depression, they may move on to questions about suicide. There's no standard method that is being used in all settings.
Trainer says suicide is the second leading cause of death for North Dakota teens. In Fargo, Ashley Bishop, Valley News Live.
The study also found that bullying and internet use, such as social media, can be risk factors for teenagers committing suicide. If you or someone you know is thinking about suicide, call the Suicide Helpline at 1-800-273-8255.